Everyone here at Trinity and Brown House have responded superbly in these unprecedented times. And the Thursday Night Clap for Carers shows just how grateful the public are for the work you are doing. The many thank yous and warm words from loved ones of patients you've cared for demonstrate this too. And we've also been receiving a number of unsolicited donations from local people and companies, with letters thanking all of you for stepping up in such challenging times. The Trinity Management Team and the Board of Trustees are extremely grateful for the compassion and commitment you are all showing. Now, we are in our 6th week of lockdown, but we do appear to be edging closer to the beginning of a downward slope of the first expected peak. And thankfully, our health services have broadly coped. It's a grim reminder, though, of just how important all our actions have been, as we've seen the number of deaths due to coronavirus breach 20,000 last week. We all have to continue to follow the government's requests if we are to keep the virus at manageable levels. Now, positively, we can expect to see some limited relaxations in the level of lockdown in the coming weeks, as the infection rate, the R0 factor, falls below 0.5. That means for every person that gets COVID-19, they essentially infect only half a person, and inevitably in that scenario, cases will continue to fall. This is really good news, but it is a fine tightrope that the government has to walk, as should the R0 factor go above 1, the NHS is unlikely to cope, as numbers will grow again and keep growing until the R0 goes below 1. Given this and the expectation that a vaccine is over a year away, we will have to get used to these different ways of working for the foreseeable future, and likely into early to mid-2021, even if we can go to B&Q or visit our families carefully. Here at Trinity, this means continuing to be ready to increase our bed numbers up to 28 should there be a need at some point, especially if we see a second and possibly third peak over the coming 12 months. We also know that it is likely that mortality rates will increase in other conditions including cancer and long-term conditions, as people stay at home worried about visiting their GP or hospital. Once some of the forced to stay at home informal carers are back in their normal workplaces, we also expect to see an increase in demand from those left at home. All of this sadly means continuing to practice the highest levels of infection control, social distancing, and the ongoing extensive use of PPE. It means continued restricted visiting for families and loved ones. It means continued suspension of many of our face-to-face outpatient services, supporting these patients remotely where we can. And it means the continued suspension of much of our training and educational activities. It also means continuing to support patients in their homes who may be COVID positive, or indeed COVID positive in care homes, in the hospital, and on occasion in our inpatient unit. This gives them the best chance of great care, and we will continue to need to innovate through the use of video consultations and other approaches to support our patients and their families and allow vital face-to-face time. And it means continuing to work flexibly, responding to where the needs are greatest, as well as taking advantage of government furlough schemes and the like to help cover some of our fundraising and retail losses. Now, it will get easier, but we all know that this is a marathon and not a sprint, and it is so important that we look after each other over the coming months. This dreadful crisis will come to an end, and we will get through the storm, continuing to adapt and respond as we have been doing so to date, and as the restrictions lift and we slowly resume our services, applying everything that we've learnt so far. Now, this may all feel overwhelming. Truthfully, it feels so sometimes to us managers too. We are all in these strange, unfamiliar times together, and it is so important to show the same kindness and compassion for ourselves and our colleagues as we give daily in the care of our patients. We are blessed with an amazing strength that comes from being part of a group of people who care about the last days and the lives of strangers. What better cause can there be but that, and it's more important now than it has ever been. So we are all good Samaritans, and I think the Fylde Coast is better for it. So we will get through this together, and I'd like to take the opportunity now to thank you for everything that you are doing and wish you all the very best for the coming weeks and months. Thank you.